This is the 100th year anniversary of the death of William Osler, who I think is the greatest physician of the past few hundred years. In view of this, I will summarize some of his thoughts, which are found in the book Aequanimitas. If you haven't read it already, then I strongly suggest you do so. The language used is quite remarkable, and the summary hereby presented does little justice to it. It regularly pops up as one of the most important medical textbooks ever written. Aequanimitas is Latin for imperturbability, and as Osler defines it, it is calmness amidst a storm, clearness of judgment in moments of peril. He felt it was one of the most important qualities for a doctor to possess. Patients indeed respond well towards the presence of the quality, and its absence does lead to a lack of trust in the physician in question. He felt some people had this innately, whereas others not so much. He did, though, give some shred of hope to those who did not possess this, and advocated that to have steely calm nerves, one must practice this as often as possible. The aim indeed is to have a cool heart, but not one hardened and impermeable to human suffering. One of the strategies for this is to actually know one's medicine as well as possible. There is also an element of patience involved, especially when it comes to ignorance. At times our patients will access quacks and others for care, and physicians must be patient with this, as after all, our patients are very patient with us as well. The other aspect of patience is to realize that one can never master the whole of medicine. Gone are the days when a polymath could learn all the available disciplines of temporal knowledge. The advice he gives is that one must learn what is within one's capabilities as well as possible, and then practice this and use this diligently, and this will then lead to further doors of knowledge opening. He gives fair warning also to students of the issues around practice during prosperity, but also in poverty, and invariably warns of the fatal struggle we face against disease and its horrors.